Yes, please do.
Yes, is it visible?
Yes, if you could put it on slideshow mode. Thank you.
Okay.
Perfect. Thank you. Perfect.
Okay. So, a brief introduction about the topic has been given by the chairperson, madam, already. So, as we know that diabetes was mainly known for its microvascular and macrovascular complications. Those are mostly like chronic disease. The important is the infectious disease. So we all know that diabetes, the people living with diabetes are more prone to infection if it's not well controlled. And and once the person gets infected, the control of diabetes is also worse. It's very important. I mean, to prevent all these things. So as we have different vaccines to prevent all these things, so we can prevent this and the complications further. So, but the issue is that in spite of knowing all these things, that prevention is better than cure and everything, but still there are some myths, some glitches, something which some barriers are there which prevents this vaccination. And also for blood donation, it's also something as the chairperson madam said that it's a novel job. It's very important for the society, but again there are certain myths about this that whether a person with diabetes can donate blood or not. So let's break those myths with some facts. So this is from the history. We all know this picture. This is Dr. Edward Jenner, who is giving something which is the uh, extract from a pustule of a cowpox lesion of a person, and he is inoculating it in a 8 years old boy. His Master Philip. So, and it was seen that after giving this, he had a mild course of cowpox, but did not develop the debilitating disease that is smallpox. So that was the first thing. That was the first successful investigation. Though there are many ethical, I mean, some issues are there, but still, this invention, this discovery has changed the history. I can say that it's a very debilitating disease has been eradicated from the world. Now, if we look back into the history, we can say that we can find that the term vaccination, it was derived from the word, it was a Latin word called vacca, so which means cow. As the first vaccine was derived from the cowpox, the inoculum from that cowpox pustule from the lesion, that's why the name was given to vaccine. So there's a very, I mean, a rich history behind vaccines. Some success stories are like smallpox have been eradicated. So we are thankful that we came after this thing. We didn't have to face this devastating disease. Polio has been eradicated from India and almost from the world except two countries, Pakistan and Afghanistan. And there are many such things. Now, vaccination is well accepted, and we know, I mean, common people also know very well about vaccination among kids, and it's well accepted also. But it's not only for kids. Actually, it's for the vulnerable group of people, be it pregnant women, apart from children, it may be pregnant women, any individuals with chronic medical conditions like diabetes, maybe healthcare workers like us, and elderly people in whom the immunity usually declines. So the immunity is like that it's immature when the person when a baby is born, then it gradually goes up, reaching to the peak during the adult age, young age, and after that it again starts to decline. So this is called immunosenescence. So in the elderly people, again it declines. So uh, there are a number of factors responsible for this immunosenescence. There is reduction in number and function of T cells, B cells, natural killer cells, and neutrophils. And as a result of that, there is impairment of functions of multiple organs, be it lungs, be it GI system, be it muscles, heart, and brain. Now, the pathophysiology of infection in diabetes mellitus, if we look into this, again, the same thing which has been already told for immunosenescence, something also works here, like reduction in T lymphocyte, reduction in neutrophil function, disorders of humoral immunity, lower secretion of inflammatory cytokines. There is glycosuria, so urinary infection chances are more. GIT person prone for infections. Again, if the diabetes status, if the hyperglycemia is not well controlled. Now, these are the vaccines recommended by CDC for all the adults. Now, among them, so there are list of vaccines given by the CDC for solely for diabetic people. There are some guidelines from RSSDI, that is Indian guideline. So the most important vaccine, um, which is very much required, is influenza vaccine. So there are different types of influenza vaccine. There are live attenuated influenza vaccine, but that are not meant for. I mean, that is not given. Usually, which is given, that is inactivated influenza vaccine. And again, there are two types of inactivated influenza vaccine. One is trivalent influenza vaccine. Another one is quadrivalent influenza vaccine. So it's recommended that it should be given every year during this August to September, October, this season, because there is antigenic shift and drift. The virus changes its genetic property. That's why it's recommended to give it every year. Annually, one dose is sufficient, and it's given intramuscularly. The dose is 0.5 ml. Another very important vaccine is pneumococcal vaccine. So again, we know that as the influenza is very frequent, very common in common people also, but it's more common in people with diabetes or having other uh, so having the immunocompromised state. So another important vaccine is pneumococcal vaccine, and again, it can cause the disease can cause. Starting from pneumonia, meningitis, and many things. And the vaccine which is recommended, there are two types of pneumococcal vaccine. One is called PCV, that is pneumococcal conjugate vaccine. Another one is pneumococcal polysaccharide vaccine, PPSV. So commonly there are PCV 13, which is commonly used. There is one PCV 10, which is used for kids in the national immunization schedule. It has been introduced recently, but commonly which is available for adult vaccination and which is available in market, that is PCV 13. But recently PCV 15 and PCV 20 have come also, but they are not available in India till now. They in US it's available, and if a person can get one dose of PCV 20, again PPSV 23 is not required. It's said like that. But if the person is that is available in India, that is PCV 13, if one dose of PCV 13 is given, so again PPSV 23 has to be followed. So after giving PCV 13, usually it is recommended to give one dose of PPSV 23 after 1 year. If the person is immunocompetent, if the person is immunocompromised, then again it's recommended after 8 weeks. It can be given after 8 weeks. And if it is less than 65 years of, if the person is less than 65 years of age, we can repeat the vaccine again after 65 years of age, provided there should be a 5 years gap between the first dose of PPSV 23 and the second dose. So this is the recommendation. Another important vaccine is hepatitis B. It is very much recommended for diabetic people because there are lots of interventions that are going on diabetic people. starting from the CGMS maybe. Not CGMS actually, it's the not continuous glucose monitoring. It's the self monitoring of blood glucose, which we frequently the people with diabetes frequently performs it on a daily basis, maybe on weekly basis, something. So there are repeated interventions, repeated tricks are there. So and hepatitis B vaccination should be given to every diabetic person. So there should be three doses. The first dose, that is the first dose which is given, it is considered as 0. The next dose is at 1 month, and then the third dose is at 6 months from the 0 dose. So there are total 3 doses, and again it's given intramuscularly, and the dose is 0.5 ml. So another important vaccine is Tdap vaccine. So it's tetanus, diphtheria, and cellular pertussis. This infection is quite common also in people living with diabetes, and also in common people also. Actually, we recognize a person having pertussis by the characteristic poop, but and it was previously said that it is more common in younger age group, in children, but now it has been shown, it is noticed that the disease is changing its there's some epidemiological transition, there's some age transition, so it's pretty common now in people, adult persons also. And again, it's more important for diabetic people, along with so pertussis, tetanus, and diphtheria. So it's Tdap. One dose is recommended intramuscularly, and then every 10 years we can follow up, we can give booster in the form of TD or Tdap. Now, the issue is that another important vaccine is varicella zoster recombinant vaccine. So, as we all know, that smallpox have been eradicated, but the chicken, once the person have this chicken pox, after that, after a certain age, or after when the immunity declines, then there is eruption of herpes zoster. So again, this is known for its painful condition. The dermatological lesion is important, but which affects a person very, very badly. That is the pain, the debilitating pain, and the important issue is that it stays even after the lesion has been recovered. I mean, the person is recovered of the lesions. Long after that, the pain persists. So there is post-orthopedic neuralgia, and many complications are associated with that. So again, a zoster vaccine, zoster recombinant vaccine is recommended. So usually 2 doses are recommended, and it's usually recommended after 50 years of age. So the other vaccination, what I have said, it can be given from adult people 19 years onwards, but the zoster recombinant vaccine is recommended for after 50 years of age, and 2 doses are required. So at an interval of 8 weeks. So first dose, and the second dose has to be given 2 months after the first dose. And dose, it can be given up to 6 months. So between 8 weeks to 6 months, 2 to 6 months, the second dose is recommended. So there are a lot of vaccines which are recommended for adults, but for diabetes, so these are the vaccines which are mainly recommended. So influenza vaccine, pneumococcal vaccine, the tetanus, diphtheria, and cellular pertussis vaccine. Hepatitis vaccine is very, very important, and the zoster vaccine. So these vaccines have to be given to all people living with diabetes. Now, as the child vaccination is very common, very widely accepted, the adult vaccination is not. So there are a lot of reasons. So what are the barriers to adult vaccination? So one important issue is lack of surveillance, proper surveillance system, lack of national guideline. There are some guidelines from CDC, some guidelines from RSSDI, there are guidelines from API also, but national guidelines, like we have our national immunization schedule for children and pregnant women. So that national guideline is lacking. Now, lack of coordinated adult vaccination program, the treatment taking precedence over the prevention attitude. So people always think of only therapy. The time the person is being affected, he or she seeks for any intervention at that time, not before that. Like diabetic people also, just maybe 2 minutes more. For diabetic people also, the people think that as I'm having, so many people, maybe more than 50% of diabetic people may not have any symptoms. So people think that as I'm having no symptom, why should I take medicine? So like for vaccines also, people think that as we are uh, having no disease at the present time, why should I take the intervention? So this is one. Now, lack of provider recommendations. It's not only from the beneficiary's perspective, from the provider also, maybe because of lack of awareness, maybe there may be some other reasons. So provider recommendation is also not there. Cost is again a very important issue, because uh, some of the vaccines are pretty costly. So these are the things. And so because of all these things, there is uh, the barriers are there. So it's not up to the mark, the vaccination. Now, just a few words about the blood donation. We, as Chairperson Madam has already said, that it's a novel job. So we know that we cannot prepare blood outside our body. So it's not available commercially. So if we have to have the blood transfusion, it has to be given by someone. So the blood donation is really very important, be it a road traffic accident, be it any planned or routine surgery, emergency surgery, be it for persons who are having thalassemia, the children, they're living a life which, I mean, the quality of life is very much compromised for the children also and their parents also. So it's the blood is very very required. So but again, there are other issues for thalassemia. It can be prevented also. So anyway, now again, there are many myths regarding the blood donation among diabetic people. So there are people who tend to give excuse that no, I cannot give blood because of such and such health related issues. But there are people who really want to donate blood, but do not know whether the person who is suffering from diabetes should give blood or not. So but the answer is yes, the person can give blood. So just a few words about that age. The person has to be above the age of 18 years. And if it is so, person can give blood irrespective of whether he or she is diabetic or not. The only issue is that the medication, the diabetes status has to be well controlled with medications. And again, in some guideline, they say that yes, in the person receiving insulin can also give blood, but in India we follow the guideline that if the person is receiving insulin, it's not recommended to donate blood. But otherwise, if the person is on medication and his or her diabetes status or the glycemic state, the glycemic control is good, then, and another thing is that if there is change of medication, the weight is in last 4 weeks, then it is deferred, because after the change of medications, the 4 weeks we can take, the person can give blood after 4 weeks of that. So there's a common quote that is donate blood and be the reasons of smile to many faces. And there's again another famous quote by Louis Pasteur. He said that when meditating over a disease, I never think of finding a remedy for it, but instead a means of prevention. So we all know that prevention is better than cure. So we can prevent the deadly infectious diseases, which can affect a diabetic people and can worsen the person's diabetic control also. So we can prevent it with the vaccination even before the onset of this disease. And but there are many myths So it's important to break the myths. One myth, this is a famous painting of James Gilray. He's a British satirist, that after giving the vaccination, so another barrier for vaccination is apprehension of side effects. So he has depicted that after giving, this person is Edward Jenner, he's depicted that he is giving vaccines, and after that the cows are emitting from every part of the body. So such was the apprehension, such was the fear. So we have to break all this fear, all these apprehensions, all these misconceptions, and all these myths with the facts to reach our goal to improve our society. So with this, so let's bust the myths with the facts. So that's all for me. Thank you.
Thank you. Thank you so much, sir, for the enriching session. So over to chairperson.
Yeah, thank you, Dr. Somnath, for excellent